Top 25 Medical Assistant Interview Questions and Answers. If you're preparing for a medical assistant interview, you're in the right place. In this video, we'll go over the top 25 most commonly asked interview questions and provide clear, confident, and professional answers that will help you stand out. Whether you're a new graduate or have years of experience, these responses will give you the edge you need. So, grab a notebook, stay until the end, and let's make sure you're fully ready to land that job. 1. Tell me about yourself. This is your opportunity to make a strong first impression. A good answer blends your background, training, and passion for healthcare. I'm a certified medical assistant with a strong background in both administrative and clinical duties. I completed my medical assistant certification from Insert School Name and completed my externship in a busy outpatient clinic where I assisted physicians, managed patient records, and performed basic lab work. I've always been drawn to healthcare because I love helping people and making a positive impact on their day. My previous experience taught me the importance of compassion, accuracy, and teamwork in patient care. I'm skilled in EHR systems, taking vitals, and handling front office operations. I take pride in keeping patients comfortable and ensuring things run smoothly for both staff and patients. Now, I'm excited to join a facility where I can continue growing professionally and contributing to a caring, efficient environment. 2. Why did you choose to become a medical assistant? Interviewers want to understand your motivation for choosing this path. I chose to become a medical assistant because it combines my interest in medicine with my passion for helping others. I've always enjoyed being in environments where I can directly assist people in improving their health and well-being. The role of a medical assistant is meaningful because it supports both patients and physicians. It's the bridge that keeps healthcare functioning efficiently. I love that it's a versatile position where I can perform both clinical and administrative tasks, learn new skills every day, and see firsthand how my work makes a difference in people's lives. For me, being a medical assistant isn't just a job. It's a rewarding career where I can grow, continue learning, and contribute to a positive healthcare experience. 3. What are your strengths as a medical assistant? Highlight your best professional qualities. My biggest strengths are my attention to detail, organization, and communication skills. In a clinical setting, accuracy and consistency are crucial, especially when handling patient data or administering procedures. I make sure every record is complete, every sample is labeled correctly, and every task is done to standard. I'm also great at communicating with patients. I know how to put them at ease, listen actively, and answer questions with empathy. Additionally, I handle multiple responsibilities efficiently, from scheduling and record keeping to assisting with examinations. These strengths allow me to maintain smooth workflows and deliver excellent patient care. 4. What are your weaknesses? Be honest but show growth. One area I've been improving is saying yes to too many tasks at once. I like to help wherever I can, but I've learned that it's important to prioritize effectively to maintain quality. I've started using better time management tools and clear communication with supervisors to ensure I meet deadlines without overextending myself. I now focus on balancing my workload to deliver consistent results and keep stress levels under control. This self-awareness has made me a more efficient and reliable team member. 5. How do you handle stressful situations? In a medical environment, stress is inevitable, especially when dealing with emergencies or high patient volumes. I manage stress by staying calm, organized, and focused on solutions. I prioritize tasks, communicate clearly with my team, and make sure I'm following proper procedures to avoid errors. I also take short mental breaks when possible to reset and stay composed. I've learned that maintaining professionalism and teamwork under pressure ensures better patient care and a positive work environment. 6. Describe your experience with electronic health records, EHR. I've worked extensively with EHR systems such as Epic and Cerner. I'm proficient in entering patient data, updating medical histories, scheduling appointments, and retrieving lab results. Accuracy and confidentiality are my top priorities when handling patient records. I also understand HIPAA compliance and ensure that patient information is handled securely. My familiarity with these systems helps me work efficiently and support the medical team in providing seamless patient care. 7. How do you ensure patient confidentiality? Protecting patient confidentiality is a critical part of my role. I strictly follow HIPAA regulations and always make sure patient records are secure, whether they're in paper form or digital. I never discuss patient details in public areas, and I only access information necessary for performing my job duties. If I receive a call or inquiry about a patient, I verify the caller's identity before sharing any information. Maintaining trust through confidentiality is essential in healthcare, and I take that responsibility very seriously. 8. How do you handle a difficult patient? When faced with a difficult patient, I stay calm, empathetic, and professional. I listen carefully to their concerns without interrupting, and I acknowledge their feelings. Often, patients are anxious or frustrated due to pain or fear, so showing compassion helps diffuse tension. I maintain a polite tone and focus on resolving the issue efficiently. If the situation escalates, I follow clinic policy and involve a supervisor or nurse when necessary. My goal is always to ensure the patient feels heard while maintaining a safe, respectful environment. 9. What clinical skills are you most comfortable performing? I'm comfortable performing a range of clinical duties including taking vital signs, drawing blood, giving injections, performing EKGs, assisting in minor procedures, and preparing patients for exams. I'm also confident in specimen collection and ensuring proper labeling and documentation. During my externship, I performed these procedures regularly and developed a strong understanding of both accuracy and patient comfort. I always double-check my work, follow sanitation protocols, and ensure that every step is done safely and professionally. 10. How do you handle multiple tasks with competing priorities? Time management is crucial in a busy medical setting. I start by identifying urgent versus important tasks and create a quick priority list. I also use scheduling software and notes to stay organized. Communication is key. If I anticipate a delay, I inform the team early so adjustments can be made. By staying proactive, I prevent chaos and ensure all responsibilities are completed accurately and on time. My focus is always on patient safety and smooth workflow. 11. How do you deal with mistakes on the job? If I make a mistake, I take immediate responsibility, report it to the appropriate supervisor, and take corrective action. I believe honesty and accountability build trust in a healthcare setting. I also review what went wrong to prevent it from happening again, whether it's a documentation error or miscommunication. I see mistakes as learning opportunities that help me grow professionally and ensure higher accuracy moving forward. 12. What administrative tasks are you familiar with? I have strong administrative skills including scheduling appointments, managing patient check-ins and check-outs, handling phone calls, billing, and maintaining medical records. I'm familiar with insurance verification, coding basics, and patient correspondence. I also assist in organizing physician calendars and ordering supplies. I believe efficiency at the front desk directly affects the overall patient experience, so I always aim to keep administrative tasks organized and accurate. 13. How would you handle a medical emergency? In a medical emergency, I remain calm and act according to established protocols. I immediately alert the medical staff, assist as instructed, and ensure the area is clear and safe. I'm trained in CPR and basic first aid, so I can provide initial support until the doctor or nurse takes over. My goal is always to respond quickly, communicate clearly, and ensure the patient receives prompt care. Remaining calm under pressure helps the team act efficiently. 14. How do you maintain accuracy when documenting patient information? I double-check all entries before submitting them. I verify patient identity using at least 2 identifiers, ensure I'm entering data in the correct fields, and cross-reference information with previous notes. I also review spelling, numerical entries, and dates carefully. Maintaining accuracy is crucial because even small errors can affect patient safety and billing. My attention to detail helps keep records error-free and reliable. 15. Describe a time you worked as part of a team. During my externship, I worked with a team of nurses, doctors, and other medical assistants in a high-volume clinic. We coordinated to manage patient flow, prepare exam rooms, and ensure timely communication between departments. One day, we had an unexpected rush of patients, and by dividing tasks efficiently, one handling check-ins, another assisting with vitals, we kept the schedule on track. This experience taught me that teamwork, trust, and communication are essential in maintaining a smooth and supportive work environment. 16. What would you do if you didn't know the answer to a patient's question? If a patient asked something I wasn't sure about, I would never guess. I'd calmly let them know I'll confirm with the doctor or the appropriate medical professional and get back to them as soon as possible. Patients appreciate honesty, and ensuring accurate information is part of providing safe care. After confirming the correct answer, I'd return promptly to the patient with the verified information. 17. How do you ensure infection control in the workplace? I follow strict infection control protocols such as hand hygiene, wearing gloves and masks when required, sanitizing equipment, and properly disposing of biohazard materials. I also ensure exam rooms are cleaned and disinfected after every patient. During the pandemic, I became even more vigilant about maintaining safe environments. Infection control protects both patients and staff, and it's one of the most important responsibilities of a medical assistant. 18. Describe your communication style. My communication style is clear, professional, and compassionate. I adjust my tone depending on who I'm speaking with, patients, doctors, or administrative staff. I believe good communication prevents misunderstandings and builds trust. Whether it's explaining a procedure to a nervous patient or relaying lab results to a nurse, I focus on being respectful, attentive, and accurate. Listening is equally important to ensure everyone feels heard. 19. How do you handle confidential calls or paperwork? When handling confidential information, I always follow HIPAA guidelines. I avoid discussing patient details in public areas and ensure documents are not left unattended. I verify identities before releasing any information and ensure computer screens are locked when unattended. Confidentiality isn't just a rule, it's a trust patients place in us, and I'm committed to upholding that at all times. 20. What would you do if a coworker wasn't pulling their weight? I'd first assess the situation to ensure it's not due to workload or misunderstanding. I'd approach my coworker privately and offer support, as teamwork often improves with communication. If the problem persisted, I'd inform my supervisor professionally without gossiping or complaining. The goal isn't to criticize but to maintain team efficiency and ensure patient care isn't affected. 21. How do you stay updated with medical knowledge? I stay informed by attending workshops, reading medical journals, and following updates from professional organizations like the AAMA. I also participate in online courses and webinars to keep up with changing technology and best practices. Healthcare evolves quickly, and continuous learning helps me provide the best care and stay confident in my role. 22. Describe a challenging situation and how you handled it. During my externship, we had a day when the system went down, and we had to process patients manually. Many patients became frustrated due to delays. I calmly explained the situation, reassured them, and helped the team with manual data entry and paperwork. By staying calm and organized, we managed the situation smoothly. That day reinforced how adaptability and teamwork can turn challenges into successful outcomes. 23. What do you enjoy most about working as a medical assistant? What I love most is the opportunity to connect with patients and make their experience better. I enjoy being part of their healthcare journey, seeing their relief after a good checkup or helping ease their anxiety before a procedure. The variety of tasks keeps my day interesting, and every shift offers new learning opportunities. It's rewarding to know that even small actions, like a kind word or efficient task, contribute to better care. 24. How would you handle a disagreement with a supervisor? If I disagreed with a supervisor, I'd address it respectfully and privately. I'd first listen carefully to understand their perspective, then calmly explain my viewpoint using facts and professional reasoning. My goal would always be to reach a resolution that supports the team and patient care. I believe in communication, not confrontation. If the decision remains final, I'd respect it and continue performing my duties professionally. 25. Why should we hire you? You should hire me because I bring a strong blend of clinical skills, compassion, and dedication to patient care. I'm experienced in both front and back office operations, comfortable with EHR systems, and known for being dependable and efficient. More importantly, I treat every patient with empathy and respect. I'm passionate about supporting medical professionals and contributing to a team that values accuracy, kindness, and professionalism. I'm confident that my attitude and abilities will make me a positive addition to your healthcare team. Thanks for watching. If you found these interview questions and answers helpful, don't forget to like, share, and subscribe for more interview prep videos. Preparing well is the key to confidence, so review these responses, tailor them to your own experience, and you'll be ready to impress any hiring manager. Good luck with your medical assistant interview, and remember, confidence, professionalism, and compassion always stand out. See you in the next video.